There are currently low levels of COVID. There's been a small surge in the RSV respiratory virus, but no significant increase. The GHA is noticing a flu B strain prevalent on the rock, as it is in Spain. Influenza A is more common now in the UK, but whatever it is, people are reportedly feeling really unwell.
When you have proper flu compared to a common cold, you can systemically feel quite unwell, and that's why we're advising people, if you develop symptoms of flu, which can be high temperature, snuffly nose, coughing, sore throat, aches and pains in your body, rest up, stay at home, plenty of fluids, and you can take some paracetamol and ibuprofen if you can tolerate it.
Well, there are those who may be feeling ghastly now and thinking, I wish I'd taken the flu jab. So is the vaccine still on offer?
The vaccine is still available. You can access both the seasonal flu vaccine and the COVID vaccine through walk-in sessions at the primary care centre.
Do you feel that perhaps because we've had, some of us, 3, 4, 5 COVID vaccines, and we've heard so much about what could have been stemming from the vaccine, that it's put people off vaccines in general?
Yes, globally we're seeing reducing uptake of seasonal flu vaccines. This year we've achieved about half the uptake that we achieved for our seasonal flu vaccine programme last year. But last year we saw a surge in about 1,000 people taking up the offer of a seasonal flu vaccine in January. So just to stress, it's not too late to get your seasonal flu vaccine. You can access it through the primary care centre.
The health authority believes we will probably experience another surge now after increased gatherings over the festive period.
We always see a slight increase in mixing of infectious diseases, both when university students come back before Christmas, post-Christmas when families have been together, and post-New Year, yes.
Okay, so flu, keep warm, stay in bed, make sure that you drink lots. I mean, that's what the doctor always tells us. But if you have got symptoms and you need to see a doctor, what should you do?
Yes, you can call 111 for advice, especially if you have a weakened immune system. We can assess you, we can refer you for testing and assess you for antivirals. So this is a treatment that might prevent you getting the severe complications of flu. So that's particularly for people if you have a weakened immune system. So for example, if you're on medication or chemotherapy, or if you're pregnant.
Despite the increase in care required, the system is coping with the demand. Everyone is urged, however, to call 111 for guidance.
We are experiencing some bed pressures at the hospital. We're having daily bed management meetings looking at availability of beds. It seems to be a range of reasons why people have come into hospital, not particularly driven by infectious diseases, but we've seen quite a sort of increase in people having falls, pneumonias, not directly related to flu, but as a secondary cause of that. So we are experiencing some pressures at the moment, hence why we're trying to get people to call 111 for advice, and we'll try and signpost you to the best location.
The aim is to try and protect A&E so it can better cater for other illnesses. Instead, anyone suffering from flu symptoms will be directed to the specialised clinic at the primary care centre.